Namaste to everyone. Basal cell carcinoma. Today we are going to discuss about the basal cell carcinoma. What is the basal cell carcinoma? It's a non-melanocytic skin cancer arising from the basal cell. That is, small round cells found in the lower layer of the epidermis. So it's a carcinoma from the basal cell of the epidermis, excluding the melanocytes, which are also comes under the basal cell. So it's a non-melanocytic skin cancer arising from the basal cell. It's basically caused by the ultraviolet rays or PTCH gene mutation. These are the most common causative factors. One is exposure to the ultraviolet rays, that is the sun rays, and PTCH gene mutation. Sometimes the UV rays causes a PTCH gene mutation also. The incidence is high in Australia and South Africa, where the more exposure of ultraviolet rays are found. The incidence of basal cell carcinoma is high in Australia and Africa. Incidence increases with age, which means the duration of exposure to the ultraviolet rays as it increases in the same way the incidence of the basal cell carcinoma also increases with age. Men are more prone than the women, and incidence doubles every 25 years. That is 3.3 million cases per year in US. Risk factors is commonly seen in the fair skin. Previous cutaneous injuries are more risk factors for the basal cell carcinoma to arise. Repeated sunburns on the same area and basal cell nervous syndrome, that is Gorlin syndrome or Bazak syndrome or Rombo syndrome or xerodermas are prone for the development of the basal cell carcinoma. And exposure to the ionizing radiation. Exposure to the ionizing radiation is another cause for the basal cell carcinoma, and exposure to the arsenic, coal, and smoking. These are the risk factors for basal cell carcinoma. Coming into the characters of the basal cell carcinoma, is a very slow growing cancer. That is zero point 0.5 centimeter. The growth rate is zero point 0.5 centimeter in 1 to 2 years. In 1 to 2 years. Color, usually skin color, or it may be a pigmented, or it may be pink. This is spontaneous bleeding on touch. That is the most character feature of the many of the cancers. And waxy papules with a central depression. The waxy papules with a central depression is another character of the basal cell carcinoma, and borders are rolled borders, that is raised borders. This is once again, as usual, the general character of the any of malignancy. Most character features is a telangiectasis, the dilatation of the vein which are fed by or near to the malignancy. So telangiectasis is a most common, is a more characteristic feature of the basal cell carcinoma. 60% of the basal cell carcinomas are seen in the head and neck region, 14% are seen in the nose, 30% are seen on the trunk, and 10% are seen on the extremities. So, head and neck and nose and trunk and extremities, the incidence as I told now. So, head and neck is the most commonest area for development of the basal cell carcinoma. Coming to the types of basal cell carcinoma, there are over 20 histological growth pattern of the BCC. The most commonest one is the nodular one. So, it's a nodular carcinoma is the most common basal cell carcinoma, and superficial basal cell carcinoma, that is common in young adult or especially seen on the upper trunk and shoulders, and it will be in the multiple in nature. Morphoic Morphoic is another common BCC next to the superficial, that is a waxy scar like plaque are seen. So next one is the basosquamous, which is nothing but the mixture of the basal cell carcinoma and squamous cell carcinoma. Fibroepithelial tumor of the pincus, so warty plaque, usually on the trunk. So these are the few of the commonly seen basal cell carcinoma. Coming to diagnosis, so skin biopsy is a gold standard method of identifying the basal cell carcinoma. Either we can go, or else we can go for the cytology or laser Doppler, which helps to diagnose the basal cell carcinoma. Treatment options, we have many surgical treatment options like excisional surgery is a cold standard method, or else we can go for the cryosurgery, laser surgery, radiations, Mohan's micrographic surgery, or else photodynamic therapy. So, excisional surgery, which will give a promising result in the basal cell carcinoma if the adequate margins are removed. Nearly about 3 to 4 mm of the skin has to be removed. So it means we have to cover the 3 to 4 healthy skin margins, so that if once you get the clear margin in the histopathological report, so recurrence chances are very less because it does not metastasize, because tumor's growth dependency is on its stroma, so it grows through the stroma only. So hence, so metastasis or the local or regional spread is very rarely seen. So this is about the basal cell carcinoma. So thank you, thanks for watching my video.